Hello dear students, welcome to Ganesh Nursing Academy. So till now I have discussed important MCQs on ECG. So today I will begin with a discussion of important MCQs on defibrillation. Okay. So I hope all the MCQs which I have discussed in important MCQs in ECG, like totally I have discussed for 5 parts. Okay. So that is going to help helpful for you. So all of you please watch those videos so that entire thing is covered about ECG in those 5 parts. Okay. So now let's begin with the next discussion, that is a important MCQs discussion on defibrillation. Okay. So defibrillation is nothing but it is a shock that is delivered to the patient when patient is running with some lethal arrhythmias, very dangerous arrhythmias which can leads to cardiac arrest. Okay. So to give a electrical shock, to give a shock to the patient to terminate the lethal arrhythmias, we want a defibrillator machine. Okay. So we use a defibrillator machines to deliver the shock, okay, and to terminate the lethal arrhythmias. Okay. So today we are going to discuss important MCQs on defibrillation. Defibrillation is a process of delivering the shock to the patient. Direct current is delivered to the patient heart. Okay, so that to terminate the lethal arrhythmia, to terminate the dangerous arrhythmias, and to bring back the rhythm normal. Okay, so let's discuss important MCQs. Okay, so question number 1: which of the following is not a shockable rhythm? Means which of the following rhythm is not shockable? Means for which the shock is not given. Okay, in which of these following the shock is not delivered? Okay, option A is pulseless ventricular tachycardia. Option B ventricular fibrillation. Option C supraventricular tachycardia. Option D is a premature ventricular contraction. Okay, so in this one, pulseless ventricular tachycardia, ventricular fibrillation, and supraventricular tachycardia, these are all shockable rhythm. Okay, and non-shockable rhythm, the rhythm in which the shock is not given, is a premature ventricular contraction. Okay, so what is the pattern of ECG in case of pulseless ventricular tachycardia? Okay, in case of pulseless ventricular tachycardia, the rhythm will be like this. Okay, already I have shown you the rhythm of pulseless ventricular tachycardia is a broad QRS complex. Okay, so this is the pattern of rhythm in pulseless ventricular tachycardia. So this kind of rhythm will be there, and patient pulse, carotid pulse will be absent. So when you see this one, okay, this is a shockable rhythm. Okay. When patient is running with this kind of rhythm, what will be the heart rate? Okay, the heart rate will be more than 150 per minute. Okay, so this is the shockable rhythm. This is a pulseless ventricular tachycardia. Next, what will be the rhythm in ventricular fibrillation? In case of ventricular fibrillation, the rhythm will be irregular waves will be there. Okay, there will be irregular waves. Okay, there is no particular pattern of rhythm in case of ventricular fibrillation. And when you see the heart rate will be more than 150 per minute. Heart rate will be more than 150 per minute. Okay, so this is a rhythm where we need to terminate it by defibrillation, by using defibrillator machine. Okay, so this is ventricular fibrillation. Next one is the supraventricular tachycardia. Okay, so this pulseless ventricular tachycardia and ventricular fibrillation, we terminate this rhythm by using the manual defibrillator. And this supraventricular tachycardia, we will terminate this one. This rhythm is treated by using a synchronized cardioversion. Okay, it is also shockable rhythm, but we use a synchronized cardioversion, okay, mode to deliver the shock and treat the supraventricular tachycardia. So what is the rhythm in supraventricular tachycardia? So this is a supraventricular tachycardia rhythm where the patient heart rate will be more than 150 per minute. Okay, so this is also shockable rhythm, but not manual defibrillator. Here in case of supraventricular tachycardia, we use a synchronized cardioversion. Okay, supraventricular tachycardia and ventricular tachycardia with pulse. This is a pulseless ventricular tachycardia. Pulseless ventricular tachycardia and ventricular fibrillations are treated with a manual defibrillator, and with pulse ventricular tachycardia and supraventricular tachycardia. Okay, supraventricular tachycardia and ventricular tachycardia with pulse are treated with a synchronized cardioversion. So this you keep in your mind. Okay, so this is a supraventricular tachycardia. So this is treated by synchronized cardioversion. Okay. Next one is PVC, that is a premature ventricular contraction. So what is the this one? This normal PQRS complex will be there. Then there will be ectopic beat. Then there will be again normal QRS complex T wave. Then there will be ectopic beat. Okay. So this kind of rhythm, ectopic beats, if you see, so this already I have discussed in important MCQs on ECG. So this is known as premature ventricular contraction. Okay, premature ventricular contraction. So this rhythm is the one where we will not use a defibrillator machine, or we will not give shock to the patient. Okay. So the answer for this one is a option D, that is a premature ventricular contraction. So this rhythm is where we will not use a defibrillator machine to terminate the rhythm. Okay. So I hope this concept is clear for you. Now we will discuss about the next question. Question number 2, recommended energy for monophasic defibrillation. So in defibrillator, there are two types of defibrillators are there. That is biphasic waveform defibrillator and monophasic waveform defibrillator. Okay. Suppose you are using a biphasic. What do you mean by biphasic defibrillator? Biphasic defibrillator means the electrical current will pass through unidirection, in one direction. Okay, it will pass through one time over the heart. Okay, through the heart. And what is a biphasic defibrillation means? The electrical current will pass through in a two direction. Okay, it will pass through, again it will come back. Okay, so there will be two direction electrical current will be passed. So that is in case of biphasic. In monophasic only unidirection. Okay, so the electrical current will pass through in one direction. Okay, so this is the basic difference between monophasic defibrillation and biphasic defibrillation. Now what is the question? Recommended energy for monophasic defibrillation. Okay, so when we use a monophasic defibrillator, what is the energy? What is the energy we have to select to give a shock to the patient? Okay, option A 150 joule, option B 200 joule, option C 250 joule, option D 360 joule. Okay, so when we use a monophasic defibrillator, okay, all these are the wrong option. Okay, all these are wrong option. And what is the right option is 360 joule. Directly, when you use a monophasic defibrillator, directly we have to select a 360 joule energy, and directly we have to deliver the shock. Okay, so that is the answer. Okay, so when you are using a monophasic defibrillator, we have to see directly 360 joule energy is selected, and directly shock is delivered to the patient. Okay, no 200, 150, 200, 300, 360, not like that. Directly we can go for a 360 joule energy we have to select, and shock is delivered to the patient. So answer for this one is a 360 joule. So recommended energy for monophasic defibrillation is 360 joule. This is the answer. Okay. Now question number 3, recommended energy for biphasic defibrillation. Okay. So when you want to defibrillate the patient using a biphasic defibrillator, when you use a biphasic defibrillator, okay, that is a the current will pass through in a two direction. Okay, biphasic. Okay, two direction, through two times the electrical energy will be passed over the heart. So in this one, what is the option here? Option A 100 to 150 joule, option B 150 to 200 joule, option C 250 to 300 joule, option D is a 300 to 360 joule. 300 to 360 joule. Okay, so whenever we use a biphasic, defibrillator, okay, so the recommended energy for biphasic defibrillator is 150 to 200. Okay, so 150 to 200, we can start with the 150 and we can increase up to 200 joule. Okay, so nowadays this biphasic defibrillator is commonly used instead of monophasic defibrillator, because it is more effective and energy required for this defibrillator is very less compared to the monophasic defibrillator. So that is the reason why we commonly use a, nowadays the available defibrillator are usually biphasic defibrillator. And what is the energy selection for this one? 150 to 200. Okay, we can start with 150 or directly we can start with the 200 joule. So what is the range is 150 to 200. So recommended energy for biphasic defibrillator is 150 to 200 joule. Okay. Okay, dear students, let's see next question. Question number 4. Which dysarrhythmia is indicated for synchronized cardioversion? Okay, so this synchronized cardioversion is a type of defibrillation only. In this one, what we do here, in the defibrillator machine, what we do, we just switch on the synchronized button, and then what happens here, we will deliver to the shock. Okay, so what happens in synchronized cardioversion, the shock will be delivered at the arrival. Okay, the shock is delivered at the arrival of R wave. Okay, for example, this R wave, no? So at the arrival of this R wave, a shock is delivered. Okay, so that is the reason when you want to deliver the shock to the patient, to the heart of the patient, at the arrival of R wave, so we have to keep the synchronized button on, switch on. So okay, so first after switching on the defibrillator machines, we have to connect the patient with the patient lead. Defibrillator lead should be connected to the patients. After that, we have to switch on the synchronized mode. Okay, synchronized button has to be switched on. Okay, then only we can keep a paddle, and then the machine will deliver to the patients on the arrival of a R wave. Okay, so in which condition this synchronized, in which rhythm is, okay, in which arrhythmias this synchronized cardioversion is indicated? Option is ventricular tachycardia with pulse. Option B, supraventricular tachycardia. Option C, both A and B. Option D is a none of them. Okay, so this synchronized cardioversion, it is indicated for both ventricular tachycardia with pulse and supraventricular tachycardia. Okay, so ventricular tachycardia means already I have shown you the rhythm will be, okay, so this is a pattern of rhythm of a ventricular tachycardia. This is a ventricular tachycardia, but this ventricular tachycardia, if it is running with pulse, okay, when you see this kind of rhythm is going on, and when you feel the pulse of the patient, pulse is present, so then we go for the synchronized cardioversion. If this kind of ventricular tachycardia is running and patient does not have carotid pulsation, then we will go for the manual defibrillation. Okay, manual defibrillation will go. Okay, not the synchronized cardioversion. Okay, and another indication for this synchronized cardioversion is, that is supraventricular tachycardia. Okay, so supraventricular tachycardia, that is so this is a supraventricular tachycardia. So this supraventricular tachycardia, SVT, supraventricular tachycardia. Okay, if this kind of rhythm is going on, so immediately we have to switch on the defibrillator machine, switch on the synchronized mode, and then shock is delivered to the patient. Okay, on the arrival of, the shock is delivered to the patient at the arrival of a RV. So here option A, ventricular tachycardia with pulse, is right option. Option B is a supraventricular tachycardia. This is also correct. So option C, both A and B is the correct option here. So option C, both A and B is correct. Option D is the wrong here. Okay. So answer for this one is both A and B. So in case of both ventricular tachycardia with pulse and supraventricular tachycardia, we will use a synchronized cardioversion. Okay. Okay, dear students, let's see next question. Question number 5. Which of the following statement is not true? Not true about AED. Okay. So here they have mentioned which of the statement is not true. Okay. So which of the following statement is not true about AED? AED means automated external defibrillator. Okay. So AED means automated external defibrillator. So somebody will think that AED means automated electrical defibrillator. No, it is not. It is automated external defibrillator. Okay. So what is the automated external defibrillator? This automated external defibrillator, it is a defibrillator machine, portable defibrillator machine, which is usually keep in a, we'll keep it in a public, high public moving area like a railway station, airport, okay, or a bus stand. So whenever any person is met with a cardiac arrest, so we can use this automated electrical defibrillator. So everything is programmed in this one. Okay, so it will give full information about patient. It only detect the rhythm of the patient. It only decide whether the shock, it is a shockable rhythm or not shockable rhythm. It only select the energy and it only deliver energy to the patient. Okay, so here this can be operated by any layman person. Okay, any person can be operated, any public person can be operate this one. Okay, so which of the following statement is not true about automated external defibrillator? Option A, AED have a rhythm detection capacity. Okay, of course this AED is having a rhythm detection capacity. It has a capacity to detect the rhythm of the patient. AED have ability to advise the operator. Okay, so once this AED is open, it will start advising the operator. So this is also programmed in the AED. That is, AED has the ability to advise the operator. It will advise the operator. Then AED can used as a pacemaker. Okay, so this is the wrong option here. This is a wrong statement. AED cannot be used as a pacemaker. Okay, so pacemaker will be different and AED is different. Okay, so AED cannot be used as a pacemaker. This is the wrong option here. And next is AED delivers shock automatically. Yes, so AED will deliver the shock. It only select the energy and it only deliver the shock. So it will deliver the energy automatically. So that is why it is a automated external defibrillator. Okay, nothing, we need not to do anything here. Every care will be taken by the machine only. Okay, it only when once we open this AED machine, it only start giving instruction to the operator. Okay, it only detect the rhythm. Okay, it will instruct the operator to apply the leads. Okay, pads over the chest, and it will once it detect the rhythm, if it is a shockable rhythm, it will ask the operator to separate from the patient and it only automatically select the energy and delivers the shock to the patient. So that is why it is a automated external defibrillator. Okay. So I hope today's session is very informative for you. So hope this will be helpful for you. Okay. So all of you, if you like this one, please press like button and share to your friends as well. And if you are not subscribed to the channel, please subscribe to the channel.